Hello, you are welcome back to this channel, my channel Love Your Health. Don't forget to subscribe. I hope my video on hypertension part 1 was so educative. In the part 1 we look at the global picture when it comes to hypertension, and also what hypertension is, what blood pressure itself is, the signs and symptoms of hypertension. So in today's video, I'm promising you the types of hypertension. In today's video, we are going to look at the types of hypertension and also the cause of hypertension. You are going to find out whether there's any cause at all for hypertension. So today, stay tuned and watch this video. So let's go on. We have two major types of hypertension according to World Health Organization. You have the primary type of hypertension, which is also called the essential hypertension, and you also have the secondary type of hypertension. Then you also have another one that falls under the secondary one, which is the gestational hypertension or pregnancy-induced hypertension. So we're going to look at them today in this video. So before we go on, let's see whether there's any cause at all for hypertension. According to WHO, hypertension is idiopathic, meaning that it has no single cause, but there are other things that are predisposing factors, or there are risk factors, or there are things that put you at risk. So with the primary type of hypertension as idiopathic, it has no cause. The secondary one, the secondary type of hypertension, the type of hypertension that you have an underlying cause that makes your blood pressure to go up, or any underlying condition, medical condition that puts you at risk of getting the hypertension. So a disease like kidney disease, it puts you at a higher risk. What kidney disease does is that the kidney itself performs a function by filtering your blood, or in a layman you say sieving your blood, or filtering your blood to make sure that every blood that goes to any part of the body is clean from anything that will occlude or block the blood vessels. So if this happens and the kidney is in trouble, or the kidney is diseased, that means that function cannot be performed well. So in this case, your blood vessels can be occluded or blocked or narrowed in any form, preventing the heart from not doing its work properly, and also making the heart to work extra harder to be able to pump blood to supply to the other parts of the body. Diabetes is another thing under the secondary type, which puts you at risk of getting high blood pressure. What happens in diabetes is that when the glucose level is high in the system, it damages your nerves and weakens the blood vessels, and making the heart weaker. Therefore, the heart cannot perform its function as it's supposed to be. And when that happens, the blood pressure goes up. Then we say you have a secondary type of hypertension. So in summary, hypertension comes in primary form, which is idiopathic, which no one knows what causes it. Then the other form is a secondary type, which as a result of a condition that makes the blood pressure to goes up for you to have hypertension. Then we say you have the secondary type of hypertension. Then we also have the gestational hypertension, or the hypertension that is come as a result of pregnancy. So we call it pregnancy-induced hypertension, or pregnancy-induced high blood pressure. You know, when you are pregnant, what happens is that there's pressure on all internal organs to work harder to supply or to give you what you need for your child and yourself to live healthy and go through the pregnancy with minimum or little risk, and deliver your baby safe, mother safe. So when the pressure goes up, that when there's pressure on the organs and the heart as well, what happens is that the heart has to work harder, and the other organs have to perform work harder. So it doesn't affect only the blood pressure, but any other internal organs have to work extra harder to provide for the baby in utero. If that happens, your pressure goes up. Then we say you have a gestational high blood pressure, or pregnancy-induced hypertension. So that is about the types of high blood pressure. So let's see if we have any cause. We don't have any cause for high blood pressure, as I said. So in my next video, we'll talk about the risk factors, and I'll group them under modifiable risk factors and non-modifiable risk factor, for you to be able to understand it well, so that you avoid the risk as much as possible. The one that you can avoid, you run away, far away from them. The one that you cannot do anything about, then you leave that to God. So please, I hope this video has been so educative. Please go to YouTube and subscribe to Love Your Health YouTube channel. Love Your Health. It's very important. Love your health. Share my videos, like them, and don't forget to share your comment. Send your comment to me. Send your comment. It's very important to send your comment. See you again in part 3 of hypertension. This brought us to the end of part 2 of high blood pressure or hypertension. Another name is silent killer. Bye bye from your preventiveness.